Drummond.
Thank you very much, Mr. Deputy Speaker. This pandemic has put a great strain on society and our economy, but it has also shown the strong social cohesion in the country. People have worked together and cooperated with what the science has suggested will beat this virus. Now, as a Conservative, I do not like to see restrictions on our freedoms any more than the other honourable members. But the measures we've put in place to combat this fast-moving novel virus has saved lives. If you compare the pandemic with the Spanish flu epidemic after World War I, it was driven by ineffective measures to prevent transmission and incomplete responses when it was clear that there was a fast-spreading pandemic. The Spanish flu killed 50 million people worldwide and at least 250,000 in the UK, double the number of those that have died so far from COVID. We said we needed restrictions last year to protect our NHS and to allow it to function, and they have worked and they have saved lives. Of course, we sympathise with everyone who's lost a friend or relative or is suffering from the effects of long COVID. However, it must be clear that the situation would have been much worse if we'd not had the restrictions. Because we've contained the virus more, we can now move along the roadmap, and I welcome the revocation of the all-tiered regulations with the new framework. That will allow us to reduce the levels of restriction at each stage. And I quite understand the concerns of constituents who want to see us move on from lockdowns and get back on track. But we do need this framework to avoid a free-for-all at a time when we still have to vaccinate such large numbers of adults. We must keep our guard up against potential new variants and the emerging new wave in the EU and elsewhere. New mutations can develop when the virus is able to spread through unprotected populations. My support for these regulations was reinforced yesterday at a meeting at the Hampshire Local Resilience Forum. We heard from Dr. Nigel Watson, a retired GP, who, like many others, has come back to help with the NHS. He would like to continue to help with the backlog of medical cases over the next few months. Extending the regulations will allow him and others to do this. The help of Dr. Watson and others is an extremely important part of getting the NHS back to normality. So I'm pleased that we're extending Section 2 of the regulations to ensure this. His story is typical of so many people who have helped in our national effort to limit this dreadful disease. So I want to finish by thanking him and everyone else in the NHS and public sector who have worked so hard to support society so that we can now move on again. So I will be supporting the extension of these regulations. Thank you, Mr. Deputy Speaker.
Thank you very much, Drummond.